Hello and welcome, my name is Chris from ChristopherHole.com. In this video we are going to be looking at low back pain and medication. Now when it comes to low back pain, it can be very painful. So one of the first things that people do is they will go to some kind of painkiller to ease the pain. Now there's nothing inherently sort of wrong with that, because I know from personal experience that a painful back is very painful and medication can certainly ease that pain and make dealing with it that much better. But it's how you deal with it and how you use the medication that counts, because medication is or can be helpful in the initial period just to ease the pain off, just so it makes it a little bit more bearable. But what we have to do in the long term is understand that it's masking the injury. Because if you look down in onto the sort of the third bullet point about pain, is that it's essential for healthy living, because pain is your body's response to let you know that something isn't quite right within the system, within the body. So it's there and it's essential for that. If it gets too painful, take some medication, there's no problem with that at all. But what we have to understand is that painkillers are masking the injury. So let's just say you've got inflammation to the muscle. What your body will do is it will notice that there's damage to the muscle. It will obviously start to inflame it to start the sort of the healing process. And what it will also do is it will send out pain signals to let you know via your nervous system that, go easy on this area of the body. Don't do anything stupid with this area of the body right now because it's damaged. So that's kind of why pain is essential, because it's letting you know that something's wrong. If you continually take painkillers, you're just masking that injury and you're covering up that damage. And what you can then do is carry on with your normal daily life and cause more problems, and then the body can't let you know because the pain signals are being suppressed. So what we have to do is we have to use medication intelligently. Obviously in the initial periods, take it because I know it can be painful. But in the long term, what we have to do is we have to start treating the cause, which is what's causing that pain, rather than just treating the symptom, which is the second bullet point, of the pain itself. So if, for instance, sitting for long periods of time in a hunched position is causing pain, we have to do something about that. If repetitive lifting incorrectly is causing the pain, we have to correct that. Those are the causes of the pain, because that's what's giving you those pain signals. If we can do something about the cause, we can then minimize the pain, rather than just doing things incorrectly, either sitting, lifting, whatever may be causing your back pain, and then just treating the symptoms of pain when they come along. Because if we do things incorrectly, that's going to increase our risk of low back pain. If we do things correctly, that's going to reduce incidences of low back pain. So when we are using medication, it's about doing it intelligently. Don't overuse medication. It has its uses, but not necessarily in the long term. Okay, so hopefully this has been helpful. My name is Chris from ChristopherHole.com. If you want to come along and watch more videos, by all means come along, click on the blog. There's plenty of videos on there. And if you want to obviously get involved in some 12-week programs, they're downloadable on the website. By all means do that. So many thanks for watching. I will speak to you in a future video.